Now, in an effort to assist men, Ligwalagwala FM held its first men's dialogue known as Phefumula Ndvoda in Mbombela, Mpumalanga. The Siswati station aims to bring together men from various communities to form support groups. Different stakeholders participated in this event, which marked the end of Men's Health Month. Prevention coordinator for the South African National Council on Alcoholism and Drug Dependence, Sibusiso Mthembu, joins us for more. A very good evening to you, Sibusiso. Thank you so much for your time. How is this programs such as these, would you say, are beneficial in getting to the bottom of some of the challenges around gender-based violence, more so as we take a look at how this impacts men?
Well, good evening to you and also to your viewers. And I think it's so important for us because around this time we are not only looking at raising awareness in terms of issues that are affecting men, but it offers them an opportunity as a safe space where they can talk about their challenges that they are affecting them, whether being internal or either external. So we were able to reach to men and talk about issues that affect them, especially when it comes to alcohol consumption that leads or either be a part to addiction.
What are some of the challenges that come with some of these conversations and what men are feeling and perhaps not even able to express and not given the platform to express their emotions?
I think it's one being your health, reproductive health, issues of financial freedom, property talks, men's medical health, and also, a role of a man in a modern society, and also what women are expecting from men. Those are the issues that they are facing at the moment.
And as you navigate around some of these issues, what have you found in terms of what stands out? Because the automatic assumption is that when it comes to gender-based violence, women are very often the victims, but that's not necessarily the case, is it?
Definitely, because I think we should be able to understand the expectations from the community and the society when it comes to issues of men that are battling with history of trauma that has happened to their life, and also they are battling with them not being able to speak about their issues. You're looking in South Africa at the moment, the issue of unemployment that also comes with a burden to them that makes them also not to be able to talk about it. So they tend to go to alcohol that aggravate also issues of anger, increase the occurrence of GBV and also the severity of GBV. But also because they've got families that are expecting them to be able to feed them, and they tend to find ways as coping skills to deal with what they are facing in the community.
Yeah, and what has also been established is that gender differences in suicide rates have shown to be more significant as males die by suicide more frequently than females. What are some of the conclusions as you try and get to the root causes to perhaps eradicate the scourge of gender-based violence and also empower men?
Look, one of the things that maybe we were able to deal with was that the issues of depression that men are also facing, men should not wait for red flags, and that they need to also to strike balance in terms of the work and also their personal life, and also that we need to challenge each other as men to talk about issues, also to guard against the issues of anger, that your 5-minute anger can also be, 5 years in imprisonment. So we are trying also that they need to find a space to talk about their issues. It should not be only once off, but it should be something that we do it each and every time.
What would you say are some of the red flags if one has to internalize and scrutinize themselves before seeking help?
Well, some of the red flags that we see from men, it will be using anger as a defensive mechanism. You know, the use of alcohol also. Most of the men that are not able to battle with issues of depression and anxiety, and also the stigma around men going out to find help because it's a sign as if that they are weak and they don't want to access any health care that is available for them. So those are some of the red flags. Also, work pressure that they find when they go out in a workplace. So those are the issues that they are facing.
And very quickly, before we let you go, where can they get help?
Well, we do have resources that are waiting for them. Well, in terms of alcohol, SANCA is there to assist them. We also have a number of organizations that we're able also to share their information. But also we are saying that men need to go out to like your healthcare centers to find issues where they can also be assisted. But as SANCA, we are saying that we are there in terms of dealing with addiction.
Very well. Thank you so much for your time. Let's perhaps leave it there for now as we're speaking there to the Prevention Coordinator for the South African National Council on Alcoholism and Drug Dependence, Sibusiso Mthembu, speaking about some help when it comes to men dealing with internal problems. Now.